Hi everyone, welcome back to another video. We have a very special guest with us today, Rowena, who is also a doctor. Two of our members couldn't be here today, but we hope you'll enjoy what we have for you today. So we have a few questions for Rowena that Hope is going to ask.
And they're not too serious.
Yeah, just
She's already overthinking. They're not too
very
serious.
simple.
Okay.
Okay, you ready?
I hope so.
Relax. So the first question is, what would you have been if not a doctor?
I can't sing. I always wanted first to be a doctor from like when I was 5.
I feel like I'm the one who doesn't have that story.
No, but recently, I mean, my dad was a creative, and I do have a bit of those interests. They were not nurtured, of course.
There's still time.
Because 844. But I probably would have been somewhere creating something, or creating in this sense, I mean even a chef or yeah. Other than that, I was very good at sports.
Why didn't you pursue that? You know they're making money.
Basketball.
You sleeping and they're making money.
Yeah. I didn't think that was a very solid plan in Kenya. I actually wanted to do sports medicine at some point.
Imagine I also considered it, but I was just like, Sasa, where will it go?
Yeah. So with that, I've always been an empath, and I always just wanted to do something that felt humanitarian. Yeah.
And I feel like you're still in that path.
Yeah.
Okay. 19 or night out?
19.
Both of you are the same. You don't like
19.
No,
once in a while, night out.
Yeah, but generally
19.
Cats versus dogs?
Dogs.
Oh, thank God.
Just one cat. That's all
I feel like cats.
Why?
Cats go outside a lot.
Where do you want a cat?
Well, I have a ratio. For every 2 dogs I have,
please.
1 cat. Like for real. So if I have 4 dogs, I have 2 cats. If I have 2 dogs, I have 1 cat. Yeah. You have to have the balance. So the next question is, city or country living?
Country. Everyone knows this.
Why
about
country?
me. First, I did live in the country for 7 years.
Oh, you did?
I did in Moranga.
Mm.
At some point, I think I was the only doctor in our age group or job group who still lived near their workplace. Yeah, I just value peace, good food, fresh food,
Fresh air. No traffic.
No traffic.
No noise.
Yes.
Oh my gosh.
Yeah, but there's no money there.
Not as much, but yeah. Okay. Then beach or safari?
Beach.
I feel like I'm in between.
Safari for sure.
I'm in between.
Really?
Yeah, I feel like I can't choose.
I
can't choose.
hope I feel like you're more of a safari.
Really?
Yeah.
I feel like the safari views are just breathtaking, like wow. But even the beach is nice, but after 2 days, like in coast, you're like,
Yeah, so tumeona mchanga and then now.
Okay, then the next question is, what year was it 30 years ago?
You mean 31 years ago?
No, 30.
30. 30 years ago was 91.
Okay.
Yeah.
I was thinking it to be like 1980.
Because I'm 31, I know. So
Oh, you're 31?
Yeah, I'm 31. Yeah.
How is being over 30? How has it been so far?
More peaceful,
Really?
more grounded. Like you really know what you want.
Okay. I hear that a lot.
Yeah.
I hope it will be the same for
Yeah, it's how
all
you
of us.
graduate after character development.
You heard it from here.
Is that true?
The next question is, as a doctor, do you feel more knowledgeable than the general population?
You're really putting me
On the spot.
on the spot.
Sema tu
Yeah, just
kweli.
say it as it is.
I mean, I feel like people who are in services that are consumed by the public, that the government is responsible for, that is education and healthcare. are definitely more exposed to what happens in the society than others, because those things are affected by politics, by, I don't know, church, what. So you probably know a bit of everything about those aspects. But then again, you're also not knowledgeable in the world outside your bubble.
The big one, the biggest one, finances.
Yeah.
Yeah, so in terms of general knowledge, I'd say doctors are narrower.
That's true. Yeah.
That's
I hope
true.
that's
Yeah.
the same thing I told you.
Yes,
Yeah.
that's true.
Yeah, doctors
That's
are
true.
narrower, and you have to make a lot of deliberate
Yes.
effort to interact with the outside world.
Yeah.
Yeah.
Okay. The next question is, would you repeat your worst year of med school or your worst rotation of internship? If you had one.
I didn't have very bad rotations in internship, so I'd rather do internship.
God's favor.
I was
You
about
meant
to
to
say.
God's favor, right?
No.
Wait, where did you do internship?
I did it in Morana.
Oh, okay. Was it was a good center for you?
It was with I felt like the hospital management was very invested in
That's nice.
growth of interns.
You don't hear that a lot, so that's really
Yeah.
nice.
Wow.
Yeah.
Okay.
But we were also the first few lots after, just when Devolution had kicked off, and it wasn't as controversial as it is right now. Yeah.
I have a friend who did her internship at Maragua, which it's near Muranga, I think. She was just like, where? Is this a hospital? Is this a hotel? Because she says the only thing they give the patients is accommodation. Like the hospital has nothing.
Yeah.
Nothing.
Really?
Yeah. So now that you're saying Muranga is like very okay. It makes sense now.
Yeah.
Okay. So the next
Let me clarify.
Like,
Not
but-
specifically to it. It's just that the Devolution as a system is not working for healthcare everywhere.
Lucky you've answered one of my questions.
Yeah. Okay.
Okay. Then the next question is, I think you answered this earlier, but you can still answer it.
Okay.
Would you work in a clinical field if it was a well-equipped facility with perfect working conditions, or would you continue your current non-clinical job?
Perfect.
Yeah, like everything that you wanted from a workplace.
I
you
would
were
have
given.
done internal medicine and I would have worked there. Yeah.
I mean, when things are working is so nice.
It's
very
true.
nice.
Because you make diagnosis, you treat, like the reward is so beautiful.
Yeah.
Then the next question, would you rather drive to work or cycle to work if all factors were conducive?
In Nairobi.
No, all factors were conducive. You don't have to be Nairobi. Wherever you are.
Cycle. Yeah.
Same.
Yeah.
Maybe the cars are overrated. Like, yes, it is convenient, but
But in my head, I mean, like Netherlands or something.
Yes,
Not in
yeah.
Nairobi. Yeah, not in
Sweden
Nairobi.
or something like that.
Yeah. not
In Nairobi, apana.
Mm.
Then the next question is, how did it feel when you got your first salary, and what was the first thing you spent it on? Kai, and if you don't mind, I don't know if you were paid the same.
Yeah,
but
how
would
much
you mind
was that
disclosing?
at the time?
Yeah.
So we were the lot with Kina Mwachonda who went for internship, I think more than half of it without salary. So
You're already demotivated.
yeah, so we went for like 5.5 months or something.
How are you surviving?
It's a good question.
Apart from God's grace.
Yeah.
Good vibes and inshallah.
Yeah, good vibes, inshallah, and
Wow.
still begging folks for money.
Wow.
I mean, it helped that I wasn't in the city.
Yeah.
What did I do? I did shopping for my aunt.
So nice.
Yeah, I tried to solve as many of people's problems, which was probably not the wisest thing. Yeah, black tax.
Yeah.
Yeah.
Then you realize it's never enough.
You also still continue doing it as a doctor indirectly,
Yes.
even with your time.
Yeah.
Yeah.
Oh, you didn't tell us how much it was, if you don't mind disclosing. It's the past.
The boom.
Oh, you
much
guys
is-
got a
yeah,
lump
we got a
sum.
lump sum. I can't remember that it was 300 and something. Or 200 and something.
For 5 months.
Yeah, they taxed it.
Yeah.
Luckily for 5 months.
But back in the day, yeah.
But
you paved the way for us.
we didn't even know how to calculate all those things.
Yeah.
So whatever you got,
you were just excited.
Kwanza, these guys, because I started later than them, so now they were paid their first salary December 31st.
New Year's Eve.
And it came 1.5
Yes.
months.
Yeah.
Okay.
When did you start internship?
In November.
You guys were
Beginning
paid
of November.
1 month after starting
Yeah, a
internship.
month and a half.
Do you want to tell the world how much?
No, it's so funny because it was New Year's Eve. I took my mom out to dinner, and now that time I'm still using my savings. So I'm calculating, I'm looking at the menu, like, okay, what am I going to eat? You know, maybe something not so expensive.
Straggler meal.
Yeah. And then
the money checks in.
when I
Oh
got
my
Bring
God.
the real menu, bring the real one.
I think I got an alert or something. And I'm like, huh? I'm rich.
You're like, what's your most expensive?
I'm like, oh, do you want dessert? Do you want a glass of wine? What do you want?
Everything changes. So
Accent
your hands.
changes, French.
I started talking to the waiter like this. No, I'm joking, but yeah, it was a good surprise, and I'm happy I was able to treat my mom.
That was nice. I don't remember what I don't remember what I spent it on. Of course, yeah, shopping for my mom and like my folks, but on myself. I see me don't spoil myself like that, so
Mm-hmm.
I don't know. I felt like it just being there was good enough. Yeah.
Kukatu.
Kukatu. So the next question is, so what is the recommended doctor to patient ratio?
1 to 1,000.
Yes. Is that in Kenya or
No, like
worldwide?
worldwide.
What's the
Recommended.
recommended?
Yes. And what's the Kenyan one?
1 to 30,000.
Why say it with your chest?
Yeah.
1 to 30,000?
Yeah. Yeah. So for 30,000 of you,
Imagine,
it's
there's
just
one
me.
of us.
It's just Rowena.
One.
It's just... Then the next question is, what was your biggest hurdle being a new doctor? Like once you're done with internship, what was your biggest hurdle and challenge?
After internship?
Yes, like now you're a qualified doctor, you're an MO.
Oh, okay. So being asked what to do, because internship, there's a sense of there's someone to cover you.
Yeah.
So I went to a rural facility, and we used to share calls there because it was small. So there's no intern to do the basic work first, then you do the top job. So in rurals, you see everything from Homa, the one what a CEO would see,
Yes.
to now managing the emergencies. It so happened that I came to realize doctors are not good with outpatient work. Yeah, especially doctors in government, because outpatient work is handled by the CEOs. So then you realize you don't know, you know the generic name of the drug, but you don't know what drug is in the market, for example, or you don't know what patients have been doing at home for home remedies, because you're not the first contact.
Yeah.
The CEO and the nurse, they know better. I remember, and a lot of improvising that you need to do in OPD. Like, did you guys bend the needle to remove a bean?
No.
Yeah. So those are the things. So you know how kids put beans
Yeah.
and bees?
Oh, to make like a forceps kind of thing.
So because in
Like a
machinery, you're not going to have all those tools. You just take the tip of the needle and you form a small hook like a crochet.
Yeah.
And then you hook
just
it
get it,
and
yeah.
pull it out. So those are the small things that CEOs know how to do that we just
You just be
we
lost.
didn't, because we're busy transfusing in the ward.
Yeah.
You're doing BMAs.
Like bring me the new stuff.
You're
You're like, wow, it's
Yeah.
a bill.
Yeah, so that for me
It
was,
was difficult.
but I was humble enough to just say I don't know. They know
Yeah.
that we don't know. So nurses will teach you.
Yeah. Okay. I guess for us is unemployment. Like that's a big challenge that we face at the moment. Yeah. But that's also a thing actually, when you feel like they look at you now as the doctor.
Yeah.
You're the one who says and we do.
Yeah.
Yeah.
Yet you don't know.
Yeah, that's true.
Yeah.
Okay. Then the next question is, how soon after internship did you get a job?
We just used to slide into the job.
Oh,
Were
yeah,
you-
you guys used to be absorbed.
Yeah,
Oh,
we used to be
yeah.
absorbed by the company.
Hey.
But we stayed, I mean, there was a few issues the union had to push, of course. So we finished internship in April, the end of March, and I started in July. April, May, June, July.
So
What
even
was I
like
doing?
you were having a break from internship.
Yeah, probably.
So like towards the end of internship, you really weren't thinking like, where am I going after this?
No, I knew I was going
So
into yeah,
nice.
but I knew I wanted to work in the rurals.
Actually, we met a doctor. She's a dentist actually. She's practiced for, I think she said 19 years or more than 15 years. And she's actually going to have her first job interview for the next job she goes for. Because you always had a job.
Yeah.
So she's never been gone for a job interview. I was like, what?
Yeah.
Must be nice.
Yeah.
Okay. Then the next question is, what's the most gratifying thing when dealing with a patient?
When they get well,
Yeah.
especially if they were very sick. And for kids, I used to like how kids, they change so fast. The problem is if it goes south, it also goes south very fast.
Yeah.
But when you resuscitate kids and they come up, they really come up. And that was very satisfying.
Next question is, what's the most annoying thing a patient has ever done? No shit, just say it.
That a patient has ever done.
Yeah. Or that patients do.
It wasn't a patient, it was someone who had brought a patient, a cop who had battered a lady, and yeah, his girlfriend or something, and he's the one who brought her. And we, legally, we need to involve also the cops and all that. So when we were trying to do that process and I was on night shift and I was alone with the nurse, he tried to punch me.
Hello?
No.
Yeah, he tried to punch me.
What?
Yeah. And he was like, utajua mi ni nani, and even me, I stood up and I was like, hata mi utajua mi ni
Are you
nani.
serious?
Yeah, of course, inside. But the Lord, yeah. So he tried to punch me, but guys came. We had to house her because we were not an inpatient for non-maternity cases, but we had to house her.
What? That's scary.
Oh, no.
Yeah, so those
Gosh.
cases for GBV, they're very sensitive.
Yeah. What is that thinking about? Remember the way they used to tell us that you make sure your chair is aligned
Facing
so
the door,
doors.
Yeah. Those cases, like when they bring like people who've been mobbed and then you've been left there to resuscitate, and you're thinking
sometimes
the guy might even wake up and try to run away. Yeah, it's those night calls that were a bit insecure. Really used to. Yeah.
And then at the time you're few, it's just you, the nurse.
And no, it's
Maybe
just me and the nurse.
Not
And
the
the
support
watching.
staff, the watching.
Yeah. Yeah.
So the next question is, you said you're doing your masters. How are you supporting yourself financially to pursue your masters?
I get support from my mom as well, but minimally. I mean, I have a job.
Yeah.
I lived in an area where cost of living was lower, so that really, really, really helped. Also, Strathmore has been kind because they understand people with COVID and what's been happening. They lowered our fees.
Really?
Yeah.
At time the flights are increasing and doubling.
UN, please take a leave.
The whole branch, everything.
So we talked to Strathmore Business School Management. They lowered our fees from 1.7 to 1.4.
Hey?
Yeah.
Wow.
And then you see that's staggered over 2 years. So you can pay slowly. You can pay slowly.
Would you ever, you see the way like the registrars who are working at the same time as doing clinical masters, would you ever do that? I feel like that's just burnout. Like, how are you surviving? Because now you're in school, then at night you're working, then tomorrow you're in school. How do you survive?
But you have to do it. You know, sometimes you just have to do what you have to do. Not everyone is like. It's not like if I call my mom, she will give me like
How much?
Just like that.
No, it's like very small bailouts, and sometimes I have to. It will come back in black tax in another
way.
Yeah, but so many people. Remember, we had people who did reg, who are on government sponsorship. People have families. People who are sick. People who come
like life is going on.
Life is happening for them. County maybe has not paid, or you're not being sponsored. Unfortunately, the system has made it very hard for them.
So hard.
Yeah.
And Dr. Rain talks about this all the time.
All the time.
The system is so broken.
But does it have to be that bad?
It doesn't have
Like,
to be.
It doesn't. And even socially, people expect a lot from doctors.
Yes.
Yeah, but I just tell doctors, don't try to make statements that you will ban. Because we are not. We are not
human.
We are also not rich.
Hey, say it louder. Say it with your chest.
We are not rich.
Yes, we are not.
Yeah. We're in a noble profession.
Yeah.
I feel like it's just by name. Nothing much about it. Okay, then the next question is there brain drain in Kenya? Do you think?
Massive.
Yeah.
And do you feel like it's going to get worse?
Yes. Yes.
I
It's
think
massive.
so. Yeah.
Yeah.
Okay.
People adapt to what makes them comfortable. And that's life.
Yeah.
Yeah.
Yeah, go where you wanted.
Yeah.
Yeah.
And appreciated.
And where you can grow.
Yeah, that's true.
I don't support it.
Why?
It's not the most ideal situation. If I got an opportunity to go outside to practice what I love, I would. But I don't support it as a system.
Yes.
Like you should go because maybe there's something there that maybe we don't have here. But you shouldn't go because the system has pushed you out. It should be a pull factor, like you're doing some research on neuroscience and
super specialty.
Yeah, and then that's a pull factor, then you go.
Okay.
But when it's a system like forcing you out and pushing you out, that's a broken system.
Yeah,
that's
really
so
broken.
true.
Because some people I know they're living even though they don't want to live.
Oh, that's sad.
Because of circumstances.
Because it's
Yes.
circumstantial, yeah.
Sad. So the next question is, it's a smart one. It's a smart one, so please know the answer. So, what is our current health budget in Kenya as a country? Just the percentage. You don't have to say the exact number.
I think it's between 8 to 7%. We are not at the supposed 15. We are supposed to be at 15, around 15%, 7 to 8%.
Okay.
What is it?
I checked, and it was 4.8.
It's 4.8.
Yeah.
The
And I was
recent
just like, it was okay, but it was 2020.
for
Sorry, I
June.
haven't checked 2021.
Okay.
But the one for 2019, 2020 was 4.8.
Of the GDP.
Yes.
Okay.
Yeah. The target yes was 15%, but I was just like 4.8.
Okay, you remember.
Ujaban sana.
I thought it was at 7.
And maybe
I think
it is for this year.
yeah, maybe it is for this year.
I'll check.
But I think the thing to pass across is we are far from the target.
Yeah.
We are so far. Yeah. Okay. Then the last question. You answered the last question.
What was it?
Devolution. Was it a fail or a pass?
I mean, it's
Devolution
not,
of health.
It's a devolution. It's not working very well for many counties. There are counties that are doing very well. You know, those counties that were marginalized and they were struggling.
Oh yeah.
So their leaders know how important it is to invest in healthcare because when they were under national, they were like forgotten people.
Yeah.
And then you have governors who have goodwill. So if a governor really is interested in health, like Makueni, Kisumu,
I had Lamu is doing well. I'm not so sure, but I
Maybe Kisii the last time I checked.
yeah. So if you have, it's very dependent on who's the governor at that point. Yeah, but
Generally, no.
But if we go back, do you think things would change? Like, okay, the small counties maybe they'd still be marginalized.
No, it's those things that damned if you do, damned if you don't.
Okay.
Because before we were under national, right?
Yeah.
It's not like our hospitals
Were
were
any
very
better?
glorious.
Okay.
Yeah. People also misusing money then.
And still now. And still now. Yeah, that was it. See the one it had.
Yeah.
So that was it for the video. So please like, comment, share, subscribe. Is there any I've missed?
Subscribe.
Subscribe. And be sure to catch us on the next video. Bye.
Bye.